I think the reality is that no treatment that we offer people in general in medical care, but specifically in chronic pain, is uniformly helpful for all people, is uniformly well tolerated by all people, has a duration of benefit that is forever, or even as long as we would hope it to be, meaning months, years, and so on. And we rarely have a way of predicting who is likely to benefit from a particular procedure, utilizing a procedure or a treatment, utilizing currently available strategies. Where opioids are unique, perhaps, is that unlike many of the treatments that maybe fit into the category I just mentioned, including opiates, opioids are known to be associated with other behaviors and entities, drug abuse, misuse, criminal behavior, certain morbidities, and even mortality that don't necessarily exist as commonly or as readily and in an increasing amount as we see with some of the other therapies. Because I don't think we know the real answer to how many people truly benefit from opioid therapy on a chronic basis for non-cancer related pain, but how many people do not. What I do recognize is that so much we are not seeing published case series, published registries, published case reports. We're not seeing the successes in the literature. And so there's a bias right now that everything that's basically published is very negative. And we certainly want to respond to the epidemiologic data, the emergency room data, the CDC data, the tremendous amount of information that says we're not doing as good a job as we can in utilizing this class of medicine for people, and we certainly, as a society, need to do better. However, that does not mean that there shouldn't be access to those medications for people for whom they can be very beneficial. There are certainly individuals who are able to maintain long-term benefit from these medications, also recognizing that there are people who can't even tolerate 2 doses, also recognizing that there are side effects of opiates that warrant their being monitored on a regular basis, and all these other issues that have to become standard of care in managing somebody on opiates. Right now, I don't know that we are seeing sufficient monitoring of people. I also don't know that we see careful enough. I don't know that we have a standardized. Scratch that, please. Most certainly, people who could benefit from opiates are not receiving prescriptions for various reasons, including fear of the prescriber of somehow being scrutinized for doing so. And at the same time, individuals are being prescribed who may be the worst candidates for opioid therapy. So I think that we need to relook at how we are relooking at how we use opioid therapy, but I think many people, we certainly see people being harmed by these medications, inadvertently, unintentionally, some who are misusing purposefully and abusing these medications, and certainly the silent group are those who are benefiting from these medications, and they're not the ones who are clamoring for changes. And I think that we have to protect access to this class of medication for those for whom it is the right choice.